So you're going to go like 1, 2, 3. I always listen. They don't actually have this, because all my 104 students always tell me that. Nobody told you that. I always listen under here as well, because you can hear things underneath here. That's not one of your check marks that we have to make sure that you do.
Feel or listen with a stethoscope?
Listen with a stethoscope. Okay. And then you come down and you want to pick several spots and go back in all the way down. So you're listening. The back is inherently easier. The front has all the breaths in the way. So there's a little bit more maneuvering things around, okay? But basically you need a plan. How many spots does it say? It just says auscultate each lobe of the lungs directly on patient's skin using a systematic approach comparing sounds bilaterally.
5, yeah.
Wait, say that again?
There's 5 lobes. So it'd be 5, right? Each lobe?
Okay, so yes, you're saying 5 to count each lobe. Which side of the lung has the third lobe?
Right side.
Right, okay. So if you don't listen underneath this right side, it's very hard to hear that middle lobe sometimes. Just so you know. Okay, so I would come up with a plan and I would go through and I would listen. And this also says that you have to listen for 1 full respiratory cycle at each site. So that's in and out, not a full minute at each site. Okay, so you might want to refer to your book and we'll practice that and I'll help you guys afterwards. And it might be easier if people wanted to, pull the curtains and make sure that you're really trying to listen underneath the shirts. Okay, I would prefer that because I think you hear a lot better. Then you're going to inspect the abdomen, and we're going to put the head of your bed down for a second. For distension, lesion, and scars. Okay, so what you're looking for, the first thing that you're going to look for is when you touch, it's kind of like the same thing as the touch. You want to see, you inspect, does it look soft, is it tight? Why would somebody have a really tight abdomen? Skin being taut, huh? Pregnancy, yeah, but we're not.
What is it where the old men have these really big hard bellies?
They do. I don't know.
Is that a beer?
There's also beer.
No, but there's also it's not an official term, Emma. Okay. Beer belly.
Are you sure?
You don't want to say that because it might not be. It could be distended, and some people, men do have that pronounced.
Yes.
They carry weight in their belly, and it does almost look like a basketball. But
What is that condition though, where it looks like they're pregnant almost?
ascites, like so you have ascites, which is a bunch of fluid. So sometimes people have like a big belly, but it's fluid, so it almost looks like that. So the first thing that you're going to do is you're going to inspect and see if you see any abnormalities, things of that nature. You go down and you're going to auscultate. We auscultate before we palpate.
Okay.
Okay? Whereas what do we do with respiratory? Why would I auscultate before I palpate in the belly?
You're gonna move stuff.
You're going to move stuff around in the whole bowel sound thing. So take your umbilicus, okay, and then you've got 4 quadrants. So umbilicus is here. Whatever. Okay.
Tomato.
Yeah. Okay. Come on. Okay. Right here. So then you've got these. So then you draw like an X in a square, and those are your quadrants. Did you know that? Yes. Okay. So you're listening. And what does it say here? It says you can't listen for a full 5 minutes before determining absence of vowel sounds.
Wow.
Now most of us just had a snack, so we should be able to hear vowel sounds, okay? And then sometimes people have hyperactive, hypoactive. You should be able to hear something. But that hyperactive, say somebody had like GI distress and you hear that constant grumbling and stuff and like then they run to the bathroom, that would be hyperactive, okay? Okay, then it says to palpate, feeling all around, see if there's any tenderness, okay, any bulges, okay, things of that nature. Next thing it says is assess for presence of urinary catheter. If not, we would assess if they voided. Do they have to go? Is their bladder distended? We have something called a bladder scanner that we use at the hospital. So if somebody says, I have to go, but yet I can't go, then we scan their bladder and then we see how much they have in there. And then, we would always, if somebody was very nauseous or if somebody was having a problem, we would, assess whether they were constipated, diarrhea, all that other kind of stuff. That all goes together. What else goes with GI? I don't think it's on here.
You mean like possibly a question?
What we would be asking a patient, what would be assessing with a GI situation with a
Their
patient?
eating habits?
Yep, and,
Bowel movement.
yep, we said that, nausea.
Oh,
So like, do they have nausea, are they eating a normal diet? People have self-induced anorexia,
Yep.
which means I'm not eating because I feel like I'm gonna vomit.
Does that come from stress?
There might be more to the story, but like, we'd wanna know if a patient ate. If they're NPO, we would document that. So if you go back to here, it says for GI, abdomen soft, bowel sounds present, no pain with palpation, and tolerates prescribed diet. So if a patient is NPO, we can't say yes to this. Nothing by mouth. Mhm.
No food, no liquid, no nothing.
Are they everyone?
Only ice chips. And even then,
No, nothing. NPO is nothing by mouth.
Nothing.
Like pre-surgery, right?
Or
Nothing by mouth.
say you come in, say you're critically ill
I
and
don't
we
know,
have,
it's just what does the actually stand for, please?
That's
what I
what I
said.
said.
Oh, okay.
Oh, you don't know?
nothing by mouth.
This means nothing by mouth, okay?
But it's gotta be nothing per,
Orifice?
I don't know, look it up.
It's flat.
Doesn't matter, means don't feed your patient, okay? And then, are they receiving nutritional supplements? You know, a lot of times like our chemotherapy patients are just so nauseous they don't wanna eat, you know, things of that nature. So we would wanna address that, okay? So if somebody's NPO, that's a concern. Now musculoskeletal, this is saying that we wanna look for all kinds of things in integumentary, musculoskeletal, integumentary, and then our whole range of motion, which we're gonna do after we take a break, is kind of all goes together. You can kind of do that all at once, you could mix it into your assessment, you could do all of that, you know, either together, separately, whatever you had, bits and pieces of time, okay? So what you're gonna do is, for musculoskeletal, you wanna inspect bony prominences. Is there any breakdown or lesions? When we give our bath, we would check for that. We also check for scars and moles and all that kind of stuff.
What are you
And-
looking for when you're looking for scars?
We have to document them. If it's a new assessment, brand new patient into the hospital, and they come in with breakdown, that has to be clearly documented because there is, if you get a hospital-acquired skin breakdown, your insurance company doesn't pay.
Okay.
So skin assessment is a huge other can of worms, which
So
you'll get to.
any old scar?
Yeah.
Just stick it
Well,
on.
we just document it, like it just says scar on this, you know, or if there's evidence of a breakdown, like if we turned him, he had some redness on his sacrum, we wanna document that, we wanna position him on the side, etc.
Okay.
Yeah,
So
okay.
scars could be, you wanna make sure they're old and.
On admission, we just would note it, or we'd say if there's sometimes a big scar on their stomach, and if somebody had their spleen removed, we might wanna know that, what's that from?
Yeah,
You know,
right.
that kind of stuff, okay? You can tell an old scar from a new scar, yeah.
With like take care of the moles, like you have a lot of like little freckles and stuff?
No, you
What
don't.
do we do?
No,
Not
you
just
don't.
any like.
No, anything that's like, have you ever seen like those big moles that look like they need to be removed?
Okay.
You ever
Yes.
seen that kind of stuff?
Yeah.
Yeah, those.
Yeah.
Like, well,
We'll stay out of
Oh.
hospital.
Does that appear on it?
Yeah, but as long as it's not like bleeding, like there's moles that people come in with that are bleeding and that are issues, like things that have not been taken care of. Those are the things. We're looking at bigger things,
Yeah, okay.
not little tiny freckles and things, no.
I just have a question in regards to all of this. In regards to assessment, are we doing this to every patient?
Yes.
New? Okay, because anytime I got administered to the hospital, I've never had none of this done.
How do you know they weren't doing it and they didn't
Yeah,
talk to you
not
about
as
it?
extensively, but they were probably.
If you're a
I
healthy,
mean,
you
your
have
blood
all sorts
pressure
of-
and like stuff like that, but they didn't do any of like the.
nobody listened to your lungs, listened to your stomach, checked your pulses.
I've never had anybody check my skin.
Yeah, see, like
I've never had
or-
anybody look at
Were
my
you
body.
admitted to the hospital?
Yeah, I had been admitted and I have been in ER several times.
Yes.
ER is not as
No?
worried.
Okay.
Oh, okay, I've been in ER.
You
that's
get,
what
you get admitted to the hospital
And
and
they
have to do
care,
a
they
scan.
were
They-
obsessing on a cut on my leg, like,
Yeah.
how long have you had that, how long has it been open?
You, because now, this probably happened about a year ago, they changed reimbursement. So if you come into the hospital and you do not have a skin tear, and you get one in the hospital will not pay for any treatment of that skin tear. So the hospital, or the insurance company,
Yeah.
so the hospital eats that cost, it's a really big fight now. So there's classes on skin documentation. now.
Yeah, and Sue
It
was
really
alluding
has
to
changed,
that, and
it's
that's
very,
crazy.
very different.
That's
Very
unbelievable.
time consuming for the nurse.
But they did that while you were like the emergency?
No, I was operations, so
Oh,
pre-op,
okay.
and then one, they don't want you to have any open sore. This was an old scab that I nicked shaving.
Okay.
And so I was like, oh my God, you gotta operate today because it's in my schedule. Do not, just take me down, do whatever you have to do.
So what do the physicians do? Will they go
That's my
and
whole
check
point.
our
And
entire
they
chart,
checked
make sure that
everything
they
out, you
agree,
know,
like,
pretty well.
what's that?
And that
For,
was when I
for,
was
what are they
20.
checking it for what?
I mean, apparently I have an esophageal.
Seems like a doctor should look at that.
If,
All the stuff
we
I don't
felt
know.
that there was something that needed the doctor to look at, we would call the doctor to look at it, but he doesn't have to agree with the fact that I say his butt's red.
So